everyone, welcome to part 3 of our video series, and in this video I'm going to basically be explaining to you how your practice is going to change after taking this education. First of all, we're going to focus on the cultural aspect of your practice shift. You know, there's a lot of language and there's a culture of basically infantilizing people with dementia, and this is pervasive like in homes and in subacute facilities and rehab facilities and everywhere. You know, a person with dementia sits down to eat and they get put on a bib, or when they're getting dressed, they're wearing a diaper. Language like this, and we're going to kind of talk about different alternatives, have a look more closely at the language, and really talk about how to implement that culture-wide shift that's going to have better language, which in turn is going to lead to like more respect for your clients and less of that distancing, because that's what this type of language does. It puts a distance and a safety between you and the person, which they sense and they feel. You know, it doesn't matter how progressive the dementia is, you can always tell if someone doesn't like you or doesn't respect you, or you know, is being inconvenienced by you is probably a better word to use. So we're really going to focus in on that cultural shift and empower you to change your own language and change the language of your colleagues, co-workers, and create that more positive work environment. Next, we're going to your practice will change, because at the end of this seminar you're going to learn basically how to understand why your client may be having these challenging behaviors. What is it that they're experiencing that you can't tell? And I'll kind of show you a couple of ways that you can figure out if your person is feeling unsafe, or if they're feeling lonely, or if it's a family member that they're missing, but that they can't tell you any of these things. So we're really going to focus in on figuring out what they're trying to tell you. And then lastly, you're going to be able to communicate far better with this person that you're caring for. You're going to be able to communicate that with them in a way that is non-confrontational, that doesn't challenge them in any way, and the results and the returns you're going to get on that are incredible. My main goal is that aggression, agitation, and those really maladaptive behaviors, that you will be able to head them off before they even occur, because by implementing some of these communication techniques, you're going to have far better mastery over your interactions with your client. These techniques don't require any equipment. All it requires is a little bit of skill and practice, which you're going to get. So it is going to radically transform the way you practice from the very next day, because from the very next day you're going to be noticing like these language, these environmental cultures, and you're going to be able to see why maybe what you're saying or how you're behaving is eliciting response from the person with dementia. So my main goal for this webinar is that you are able to take control of your practice, that you're able to communicate better with people in dementia in your care, and that you're able to get the results you want in terms of therapy, in terms of outcomes, and in terms of creating a more settled and secure environment, which is why we call this course Settled and Secure. That's all we want for our patients with dementia, for them to feel safe. So again, check out the link below if you want more information. You can always feel free to shoot us an email. My email is emily@arcseminars.net, or to join our Facebook group to discuss with other clinicians what you've learned. I look forward to seeing you there. Thanks.